Hello everyone, and welcome to another Week in Health with Dr. Bob DeMaria. And this week I'm going to revisit canola oil. It seems like it's in the news all the time and the people are confused, and I'm not here to give you a dissertation on canola oil. I just happened to watch even Udo Erasmus, an acquaintance of mine. I met at a seminar before, and he was talking about canola oil and really the bad effects about it. And it says now that this was from the Food Navigator, the non-GMO factor gives omega-9 canola a boost in the battle of next generation healthy oils. And you can actually do a search on canola and learn about it in your own time. I think the part that concerns me, they always talk about being GMO or non-GMO, but they don't always talk about how the oil is extracted. When I was listening to Udo in his conversation on Fox, he was discussing the taking of the oil by using chemical, for example, hexane. So to make it really simple for you, I would really prefer that you're going to use a non-GMO organic oil that is pressed. You say, okay, now what do you mean, Dr. Bob? You are throwing something totally into the marketplace right now. So many of the oils that are used today are extracted with chemicals. And I mentioned hexane is a very common chemical, and I know that they use other ones of them. And to the best of my knowledge, when something is an organic product, none of those chemicals are going to be used. So just because something is GMO or non-GMO doesn't guarantee you have health. It's just kind of like somebody saying that I'm going to be eating a product that has been not tampered with genetically, like corn, for example, and it can still cause health challenges. So personally, I would say no to canola oil across the board. And you could do your own research on it. It's really oil of Canada. It originally comes from rapeseed, and then back in the 1990s when it started becoming hybridized. And I believe right now that the food manufacturers and oil industry is wanting you to think nice, pleasant thoughts about canola. I would stay away from it. The next article that was very significant came out recently on Alzheimer's in women. And in my practice, we have many practice members who have moms and grandmas that have Alzheimer's and dementia. And because I've been practicing since the 1970s, I've seen this whole generation change. And I have something that I actually call the working woman syndrome. We have so many of our female practice members that are literally exhausted. They're taking care of their aging parents. Then they may have children who maybe have had some personal, financial, some marital issues, and the moms are in the sandwich aspect of what's going on. See, stress utilizes a lot of B vitamins. Stress is going to cannibalize oils, both of which are very important for your brain. So ladies, this is to you. They're saying that 1 in 6 women right now are going to have Alzheimer's or dementia. To keep the math really simple, that's almost 20%. That means 1 in 5, 1 in 6 of you right now are going to have a challenge with losing your mind. So this is a concern. So here's what I would suggest that you do. I personally take 2 tablespoons of coconut oil every day, and I put it on a rice cake with almond butter. Do some research on coconut oil. It's not about saturated fat. It's about helping your brain develop properly. You may consider having an essential fatty acid blood spot test done to see your DHA level. The DHA level is a long-chain fatty acid. It's important for brain. I would also eat avocados. Avocados have carnitine in them. The last thought to leave you with, just going and touching this base on Alzheimer's and dementia, avoid or stay away from proton-pump inhibitors. Those are the drugs, they're called drug stoppers, that literally are going to stop your body from having digestive enzymes in your stomach, so you're going to have minimal absorption of minerals that are ever so important for proper brain function. Very last thought, zinc. You can do a research on zinc. It's important for a part of your brain called the hippocampus. I've talked about that before in Ask Dr. Bob's. It's very important to have adequate zinc. Zinc is also important for memory. Sugar and stress take zinc out of the body. My name is Dr. Bob DeMaria, the Drugless Doctor.